Hello, my name is Dolores Lamonaco, and I'm a registered nurse and a certified geriatric care manager. I'm a member of the National Association of Professional Geriatric Care Managers and the Florida Geriatric Care Managers Association. I have lived and worked on the Treasure Coast for 20 years in the hospital and skilled nursing setting, in the fields of Alzheimer's care and education, as well as with the developmentally disabled and those with physical disabilities. For the past 12 years, I have worked with Firstat RN Care Management, a division of Firstat Nursing, a privately owned full-service healthcare provider that has been in business for 18 years since 1995. Firstat's comprehensive RN Care Management Division is one of the largest in Florida, and we cover all of the Treasure Coast as well as Palm Beach and Broward counties. We are licensed, bonded, and insured. At Firstat, all of our care managers are registered nurses and certified geriatric case or care managers. We utilize a team approach when assessing and managing your loved one's care with regular peer review and oversight. Our recommendations are individualized to fit the specific needs of our client. Nights, weekends, or holidays, there is always a care manager available to address your loved one's concerns or emergencies. Our typical client is an older adult or couple who is beginning to experience any of the problems associated with aging, such as memory loss, self-neglect, complex medical problems, or confusion regarding health care or finances. Many times, it is the adult children of the older adult who first notice the change in their parents and are seeking solutions. A Firstat RN Care Manager can provide a comprehensive, individualized assessment with recommendations to enhance the quality of your loved one's health and well-being. And we are not limited to elder care. We can also help meet intergenerational goals for elders caring for special needs adult children, which brings me to my next point. Let me tell you about one of my clients who is not typical. 10 years ago, I received an emergency call from a bank officer who was concerned about a situation in his client's home. This was a couple in their 80s who lived with their adult mentally challenged son. They had no other family. The wife had Alzheimer's disease, and the husband was a caregiver for his wife and son, although he had serious health problems himself, which included difficulty walking. The mentally challenged son had been managing the medications for his parents, and now the dad had been taken to the hospital with a medication overdose. In addition, the son was ill with the flu, but there was no one well enough to take care of him. The bank officer asked me, "Can you go over right away?" I did. On my first visit to the home, I transported the son to the emergency department, picked up medication and dinner, and made arrangements for a home health aide in the home. In the days that followed, outdated medications and food were thrown out, neglected medical appointments were rescheduled, and the family began benefiting by the personal care and appropriate medication dosages being taken. 10 years later, both parents have passed away, but I still manage the health care of the son, who is now 60 years old and living in an assisted living facility. Your situation may not be as challenging as my story, or maybe it is. One of the things I enjoy most about my job is finding solutions to challenging life situations, and at Firstat, we're experts at that. We would be happy to speak with you about the needs of your loved one. Please call us at 954-486-1990 or 866-522-2098.